Hello, I'm Dr. Indu from the Department of Medicine with a special interest in infectious diseases from Bangalore Baptist Hospital, Bangalore. Today, I'm going to talk to you about antibiotics, misuse of antibiotics, and what happens when we misuse antibiotics. I'm sure all of you have heard and read about antibiotic resistance. How does this come about? So, what are antibiotics in the first place? Antibiotics are drugs which are used to kill or stop replication of bacteria. Now, one thing that we primarily need to understand are that antibiotics are not useful against most viruses, most fungus. So, when we talk about antibiotics and their use, it is primarily used only for bacterial infections. Why I'm saying this is there is a spate of viral diseases in the city now. Not now, it has been going on, but there is a tendency for most of us to use antibiotics for viral diseases, be it an acute respiratory illness or a bronchitis or a sinusitis. What we need to understand is that most common infections in the respiratory tract are often caused by viruses, and they don't really require antibiotics. So what happens is when you have an illness, it's not gone for 2 days, your tendency is to take an antibiotic and you feel better after 2 days because anyway the viral illness would have settled in 2 days. So what we need to understand is misuse of antibiotics or overuse of antibiotics is what is leading to this resistance of mycobacteria against these antibiotics. That means when you use an antibiotics against a certain bacteria which was previously susceptible to this antibiotic, it does not work anymore. Why? Now let me explain a small thing to you. You have heard of mutations when we had a COVID illness, say in the last 2 or 3 years. So what happens to the COVID virus? The virus mutates. Each time the virus mutates, a new strain comes into being, and these strains are not do not have the same properties as the previous one. But similarly, even bacteria mutate. So when you are using antibiotics, the tendency for a bacteria to mutate increases. So what happens when they mutate is they become resistant to that antibiotics, or they develop resistance to that particular antibiotic. So what I'm trying to say is when you have a very simple viral illness, say a upper respiratory illness like a flu or a bronchitis or a sinusitis, try not to pressurize your doctor into writing antibiotics. So let your doctor be the best judge as to whether you need an antibiotic, what to use, how long to use it for. Please follow a doctor's prescription. Do not take antibiotics on your own. There is a tendency for most people to repeat a prescription which was probably written for someone else or for them in the prior illnesses. Do not do that. All of these lead to resistance. And now there is a growing concern about multi-drug resistant bacteria. So there are bacteria you should know which are resistant to almost all drugs that are available in the market today. And if we do get an infection with one of these bacteria, it's very difficult to treat. It may even end very sadly. So what I'm trying to say is, at the end of the day, please use antibiotics wisely. Please use antibiotics only when a doctor prescribes it for you. Do not repeat prescriptions. Be healthy and try and prevent drug resistance in bacteria. Thank you.